The city is a city that I have lived in and loved. Apart from AI, I have seen the city change in front of my eyes. The city is much more livable than many other cities in the country. And from a governance point of view also, it is going leaps and bounds. So it is a pleasure to come back to Lucknow after doing my Government of India stint. In healthcare system, a lot of initiatives are being taken in the area of digital technologies. I would like to specially mention something which has been recently rolled out, which is called the Unified Disease Surveillance Portal. There are 12 diseases which are by law notifiable. That means any person who has any lab who finds a positive case of, say, dengue or malaria is supposed to legally notify it to the authorities so that the authorities can take care of this, of curtailing the spread of this disease. Till now, they used to just physically notify, and one used to never know whether they have been notified or not. There was no central portal or database in which you could find where the diseases have been notified, and therefore the authorities could not really manage and plan the case-based activities of containment. Now we have a unified disease surveillance portal. All the 12 notifiable diseases in all the 30,000 odd public health, private health labs and hospitals, they notify the diseases in this portal on a daily basis. And on a daily basis, we come to know in which district, which block, which village, how many cases of malaria, dengue, chikungunya have been notified. This helps the authorities on one way to manage the system, to take care of the case-based activities. On the other hand, that citizens can get their lab reports from our website. So it is a win-win situation for everybody else. I don't think in such a scale a unified disease surveillance portal has been rolled out anywhere else. I think in health sector we have to understand that there is the concept of life and death. So there is a concept of regulation. Nobody can just play any technology and claim that this technology is going to take care of health. So in our country we have now a regulatory mechanism of the health devices rules and the CDSO, and there is a concept of clinical trials. So in health sector setup, the regulatory clearances of the startups going through and establishing their technology through the regulatory mechanism is the first step. Only then the question of procurement of such health services comes about. So I think overall this is an area in which the startups have a lot of potential, but they also have some initial challenges. Nirmaya is a scheme in which, in fact, UP government got a e-governance award at the national level also. Nirmaya is a system of healthcare staff nurses capacity increase program, in which we do believe that in healthcare, apart from the doctors, nurses have a very important role to play, and in the days to come, they will be one who will be irreplaceable, because no matter how much technology you have, the empathy and the care of a nurse is irreplaceable. So the important thing is how to build the quality levels of this nursing training, both pre-job as well as during service. And that is what the Operation Nirmaya is all about. AI has a lot of potential, but it is things whose ramifications we are yet to understand fully. But in terms of, say, cataract screening, TB screening, and these kind of screenings, artificial intelligence will, in my opinion, have a lot to play, because it is about pattern recognition through machines. Having said that, since it is an issue of life and death, these needs to be tested, and you cannot really go for this technology unless and until you're sure about the factor of safety. I think yes, one is that I was not the startup ecosystem that has been developed by the Software Technology Park of India in SGBJ campus. I'll be looking forward to what kind of startups these are, what are the key challenges they face through the regulatory mechanism as well as in the procurement sphere, and that is one takeaway to explore further. The other definite takeaway is how to collaborate with the IT department startup policy in the healthcare system, and how to expand already what we are doing through the different partners that we met here.